Necrotizing Fasciitis, Reservoir and Survivor Story, covered by Caitlin Datko. The reservoir for Streptococcus pyogenes is humans. The bacterium colonizes at the throat or on the skin, especially in the winter months. So my family's had a personal experience with necrotizing fasciitis. On October 11th, my dad sustained a compression injury on his right calf due to an accident where a car driven by a student driver jumped the curb and pinned my dad's right leg against a handrail. My mom drove my dad to the nearest hospital ER within 5 minutes of the accident. He was admitted for observation with extensive swelling to his right knee and calf. Large blisters formed on his skin, requiring frequent bandage changes. On October 15th, my dad was released to home care with Whirlpool treatment scheduled every other day to diminish the swelling. His bandages were changed every day by a visiting home health nurse. The presiding orthopedic specialist warned my parents to watch for any raised red area with a red line extruding from it, looking like a small animal burrowing under the skin. If they saw that reaction, they had to get to the ER immediately. On October 25th, my dad's primary care physician determined that she could manage the wound care and cancels the home health nurse visits and the Whirlpool treatments. After examination of the wound, the nurse's assistant discovers that there is insufficient materials to rewrap the wound. She ultimately finds some Coban and gauze to rewrap the calf. Coban is used in hospitals, clinics, nursing homes, and home care to secure medical devices to a patient, secure dressings, reduce edema, and reduce post-operative swelling, and immobilize splints to immobilize strains. My dad and my mom were nervous about the application of the Coban, but since they had been told that my dad had been scheduled for a Whirlpool treatment an hour later, they figured that the bandage would be replaced. Unknown to them at the time, the primary care physician had canceled the Whirlpool treatment. After being informed that the Whirlpool treatment had been canceled, my parents returned home. The bandage remained in place until they returned to the primary care physician the next morning. During the night, my mom checked on my dad and noted that his right foot was cold to the touch. On October 26th, my parents returned from the primary care's office in the morning as directed, and another nurse unwraps the Coban dressing. He is unsure how to care for the wound and says so. While my parents were waiting for the primary care physician, my mom looks at my dad's wound and sees a large red raised area behind my dad's right knee with a red line extending from up the back of his leg. She immediately notifies the primary care physician, who disregards the urgings of my mom. My mom insists, and the primary care physician finally relents and schedules an appointment that afternoon with an orthopedic surgeon. At my dad's 2 p.m. appointment with the referring orthopedic surgeon, Dr. Sanjay Misra, he informed my dad that he had quote-unquote dead stuff in his CAD and he would require surgery to remove it. Out of my dad's presence, he informed my mom that there was a high probability that they would have to amputate his right leg. The doctor's suspicion was that he had developed necrotizing fasciitis. Dr. Misra was able to perform the surgery at 10:30 p.m. In the first of 4 surgeries, he dissected my dad's right leg medially and laterally from ankle to just below the hip. Additionally, he quote-unquote scalloped out my dad's right calf tissue, which had already been necrotized. My dad's incisions were left to the open to be air, but packed with gauze in preparation for the upcoming wet-to-dry debridement. Again, the suspicion was that the infection was anaerobic. At the time, tissue samples were taken from the infectious disease physician. On October 27th, in accordance with the ongoing treatment plan, a hyperbaric chamber session was scheduled. The hyperbaric chamber is a high-pressure, oxygen-rich chamber, in this instance, to inhibit the growth of anaerobic bacteria, and the hyperbaric session was accomplished in the early afternoon. Just after supper, my dad experienced a severe pain in his upper chest. He was given an EKG, but it turned out to be a pulmonary embolism. He was then taken into intensive care so he could be watched more carefully. On October 28th, Dr. Misra came in to examine the condition of my dad's leg. To do so, he had to remove the surgical packing from my dad's open incisions. This is called wet-to-dry debridement. My dad says it turns out to be the most painful procedure, meaning that there was healthy tissue with feeling and adequate blood flow, and that there was no more quote-unquote dead stuff. On October 30th, surgery number 2, Dr. Misra uses the surgery to close up the incisions on both sides of my dad's thigh, all clean and healthy tissue. On November 2nd, surgery number 3, Dr. Misra works on my dad's right calf, placing micro stitches on the medial side to help reconnect the muscle tissue. That proves to be the most successful since his injury. He can now move his foot in all directions. On November 6th, surgery number 4, A reconstructive surgeon takes a large patch of skin on my dad's left thigh to seal up the lateral side of my dad's right calf, which has been open and missing skin since the first surgery. On November 7th, the wound team visits and wants to try a new vacuum bandage to help heal my dad's calf. They install a machine which helps the drainage of the wound and speeds recovery. Negative pressure wound therapy is a therapeutic technique using a vacuum dressing to promote healing in acute or chronic wounds. It promotes wound healing by applying a vacuum through a special sealed dressing. The continued vacuum draws out fluid from the wound and increases blood flow to the area. On November 18th, sufficient healing has occurred for my dad to be released from the hospital. And on November 25th, my dad takes his first steps since the accident. Now, these are pictures of my dad's legs nearly 15 years after the accident, and you can still see the effects of necrotizing fasciitis has had on his leg. And this is my bibliography.